Good evening, ladies and gentlemen, and welcome to the Voices That Heal podcast. I am your host, Jamie, aka Jams. So good to be with you guys. If you were here yesterday, you saw another episode of Voices That Heal, but this time around it was a men's health panel for the month of June because this is June, is Men's Health Month in June. So we wanted to do a focus on men's lung cancer and give them an opportunity to talk about their journeys and the things that they struggle with. It's a really good conversation. If you missed it, go ahead and check out the Heal Collaborative Facebook page and the Heal Collaborative YouTube page. It should still be there. You can also engage with it. So if you have questions, if you want to comment, show love and support, you can still do all of that, even though the show is not live. We'll see the comments and stuff like that, and we'll also answer your questions too. So that being said, this episode as well will be hosted on the Heal Facebook page and the Heal YouTube page. It'll also be shared to the Voices That Heal private Facebook group, which if you're not a part of that, please make sure you join. If you're a lung cancer patient and you are looking for a community of, people who are able to answer your questions, share their experiences and stories, and just otherwise support you in your lung cancer journey, the Voices That Heal Facebook group is a great place for that. Also, in general, you should connect with the Heal Collaborative because we are more than just lung cancer. There's several other health areas that the Heal Collaborative will focus on and does a lot of events around the country for. So more than just lung cancer. And if there's anybody else in your family who suffers from any kind of health conditions, definitely connect with Heal because there's more than likely an event that they're hosting that circles around what they're going through. So that being said, this is a special episode, and I have a couple of special ladies who are going to join me this evening. If you missed it, the ASCO conference was just happened, not even a week or 2 weeks ago, where everybody kind of traveled, and it's one of those major conferences that you kind of have to be there. And I've been dying to go, to be honest with you. And so when the opportunity to have these ladies on the show and talk about it arose, I was like, yes, absolutely. So I am going to bring to the stage with me a couple of my other fellow lung cancer survivors. You should recognize some of these faces, and I'm going to let them introduce themselves. So we're going to bring them to the stage, and we're going to let them join the conversation. So hello, ladies. Welcome back to Voices That Heal. How y'all doing tonight? You're muted, me.
I was about to be like, hello, thanks for having us. And then I was like, oh, I'm.
Yes, Jamie,
Okay, well.
thank you for having us. Thank you for doing this.
Of course. So Colette, this was actually your brainchild episode. So, introduce yourself, your journey through lung cancer, and then talk a little bit about why you wanted to have this show in the first place. And then we'll jump to you, Sydney, to introduce yourself and share your story.
Okay, I am Colette Smith. I am soon to be a 12-year lung cancer survivor. And why was it important for us to have this talk? I wanted for others out there who do patient advocacy to see how accessible ASCO is, and for us to talk about it, talk about the highs, the lows, the accessibility, etc.
Okay. And so talk about your journey through lung cancer. I know that, you've got a little bit of a wavy line to get to your diagnosis. So as briefly as you can, but also as informative as you can, just share with the audience how you came to be diagnosed with lung cancer.
I say I was diagnosed by the grace of God. I had another condition, and I went to check out the symptoms I was feeling, which was palpitations, and lo and behold, the buggers were there on the scan, and that really started the journey of me being diagnosed. I would say, though, I had to advocate for a diagnosis because my physician, my PCP at the time, wanted to stop when he heard from his peers that they don't think that it's anything. I said, well, there's something there, and if this were your wife, what would you do?
I love that.
That did it.
Yep.
That did it for me, and that led me to surgery, upper left lobectomy, and here I am 11 years later.
Killing the game. All right. So, Sydney, I'm going to jump over to you to introduce yourself and your journey through lung cancer as well.
Well, hello, everyone. I am Sydney Barnett. I am a physician and a stage 4 lung cancer patient. I was diagnosed in my intern year of residency, and that was in 2017. So I am a 9-year survivor who next year will make 10 years, a whole decade. Yes, I mean, when I was diagnosed, Jamie, same story, 33, when I was diagnosed, I didn't think that a decade would come and I would feel so well. So that's definitely something that we all celebrate, not just the fact that I've had 10 years, but 10 years just looks so different from what it was a decade ago.
Yeah. Yeah. And I mean, 30 diagnosed at 32 for me. So a year before you, which is, crazy, but what am I? I think I'll be 8 this year. So I'm really excited about that. You know what I mean? Like same thing you said, if you had said this to me when I was sitting on that, hospital bed back in 2018, when I was first diagnosed, that like I would be here 8 years later doing all this advocacy and like, being a public face of lung cancer, like we all kind of are, I would have been like, ain't no way in hell. And like, I mean that because like, honestly, at that time, I wasn't even ready to talk about my diagnosis. And I don't think I even shared mine. And most folks know my story, but I'll just give you the brief, 20-second Cliff Note version. Like Sydney said, I was diagnosed in December 2018 at age 32, no risk factors, no history of cancer in my family. And honestly, it came from what was a cough and a wheeze that, went way too long, to be honest with you. I think it took me 8 months before I got a second opinion. And then when I got the second opinion, it was like, boom, bam, boom. Now it's like, stage 4 lung cancer. And then since then, I just kind of turned that, I don't know. I don't even know what to call it. Just turn that into an opportunity to educate people and to share my story with others like you guys do as well. One thing I can say I don't have in common with you guys is having gone to ASCO. So that is something I'm going to try and do. So I'm hoping this conversation tonight is going to shed a little bit of light on the conference itself, what different capacities you can go and attend, and then also just what are some of the key takeaways and stuff that you can sort of expect when you go to a conference of this nature. Because I can't speak from personal experience, but it seems like ASCO is different from any other kind of summit event or whatever that you think that we've been to so far. So
First of all, ASCO is a whole nother beast.
Right.
Like a whole other beast. When I went last year and I went to registration to pick up my tag, and I saw the sheer volume of people, I don't have panic attacks. I've never had a panic attack. I don't have social anxiety. And I was just like, oh my God. Like, it's a lot of people. It's like 45,000 people.
Yeah.
And the venue is huge to be able to accommodate so many thousands of people. So just by that share account alone, that's one thing just to get over, is the amount of people that's there. And then after that, then of course, ASCO has so many tracks. There's so many good sessions going on at the same time. So you're kind of like, oh man, I want to go to this one, but I see that one. And I'm like, oh, I think that's one thing that I learned differently. And I did differently this year versus last year. Last year, I was so torn. This year, I was just like, they have on demand for a reason.
Yeah.
So I will go to one, and then the other one I'll watch on demand and call it a day. It's like you don't have to go to everything in person. The good thing is that pretty much the online platform is great at just putting the presentation there so that you can see it afterwards.
Okay. And so I guess we'll start with you in this part of the conversation. In what capacity did you go to ASCO? Like what was your reason for being there essentially, besides the obvious?
Well, okay. Can I just ask Colette, what was Colette's impression of ASCO? Because Colette, this is her first time going to ASCO.
Okay, yeah, let's jump back and ask Colette.
Yeah, this was my first time, and I've heard so much about it. I've been hearing about ASCO for years. I think I was actually prepared. I had the right shoes. I was prepared for the headshots. I brought like multiple changes of clothes. So I was not overwhelmed. I knew to pace myself, and I knew that I would have opportunity to see some of the tracks on demand. But it was overwhelming to hear all of the different accents and languages. I'm like, whoa, this is diversity in its truest form. So
yeah,
but I believe I managed it well though.
So ASCO is the American Society for Clinical Oncology. It's a conference that has all various types of oncologists, medical oncologists, radiation oncologists, surgical oncologists, and it's not only for one specific cancer type. They have every type of cancer: breast, colon, prostate, multiple myeloma, pediatric cancers, you name the cancer, it is there. So the sessions are, geared towards a very diverse oncology field. People come from all over the world. So even though it says the American Society, it's a very international conference. People come from China to present their research. People come from all over the world. So it really is a multinational conference, even though it's always based in Chicago.
And from what I'm reading, because I wasn't there, but from what I'm reading, the theme, I guess, for this year was just that, like, cancer care is becoming more and more individualized and personalized, so we're moving away from that one chemo fits all treatment plan for people with cancer, and moving more towards what specifically is your cancer, what is your triggers, what are the things that led to it, what are some of your comorbidities, all of
Yeah,
that kind of stuff, so that we can actually pinpoint the medicine that's going to work for you, which I think is super exciting.
Yeah, precision medicine that was definitely the buzzword of ASCO, trying to gear a very targeted or specific treatment for someone's cancer versus the all size fits all, one size fits all kind of thing, like you said, Jamie. So yeah, definitely. I mean, that is the way to go. I mean, that we have benefited from that, you and I, with our targeted therapy. It's very specific to our mutation versus having to deal with all the side effects of the fact that it could be toxic to other things.
Yep, absolutely. And for those, I guess this is a Cancer 101 conversation as well, but for those that don't know, a targeted therapy like what Sydney and I are on is a medication where instead of chemo and radiation, we're actually taking pills that specifically target the gene mutation that we have in our bodies. So instead of just kind of throwing it all against the wall and seeing what sticks, consider it more like a sniper who's like really just targeting that one cell, So
I like that.
I like to say, instead of a flamethrower to kill everything, you got a sniper that's more precise. That's what Cindy and I have in our arsenal, what we're taking currently.
I like that.
And it's only getting better. You know what I mean? Like when I first got my diagnosis, alectinib was the end all be all. It was the most current medication they had. It was like the latest and greatest. And I always kind of had a little fear in the back of my mind, because I'm like, hey, if I have progression on alectinib, the hell do I jump to from here? And so even now, 8 years later, there's plenty of different options, plenty of different pathways. There's so many different, more personalized ways that I can now look at treating this cancer if I do get progression, down the line. So it adds a little bit of relief knowing that there is another leap pad that you can jump to, in the pond. You're not just like stuck on this one, and when it sinks, you're going down with it. So that's something that's really exciting. But yeah, so I think in general, overall, I don't think anybody really understands the caliber, because if you're like me and you've been to some lung cancer conferences, it's, a couple hundred people, it's really not a ton of folks, compared to what ASCO is. So I think I would probably have the same kind of panic attack that you did.
But I heard it's a lot of people, but I don't think I've ever seen that vast amount of people before in my life. So I think that was what it was. But to get back to your question, I was there this year in the capacity that I was invited to be a speaker and a chair for one of the educational sessions. And I remember thinking when I saw the email, you want me to chair? Okay. Just because, it's a very scientific conference, and to have the patient advocate as the chair is a very interesting spin. But I actually appreciated that because it helped me to kind of gear what the conversation would be like and make it very much patient centric. In terms of dealing with when does acceptable become unacceptable, in terms of the toxicities of a lot of these new drugs that are coming out. Because, unlike the medication that we're on, Jamie, a lot of these medications have a lot of side effects, and at what point do the physicians really say, okay, this is unacceptable? It might be and is likely very different from a patient perspective. So that was, for the most part, the gist of the conversation that we had there.
And before we jump any further in, I want to introduce or have my next panelists introduce themselves. So Brandi's joining us as well. She also attended ASCO this year, and so we're going to get her expertise too. So Brandi, why don't you introduce yourself and just talk a little bit about your journey to lung cancer, and also what brought you to ASCO this year?
Hi, everyone. I apologize for being late. I was trying to make dinner, and then I was having technical difficulties.
It's all good.
I didn't know how to work this. But anyway, so yeah, I am Brandi Bryant. I am a 8-year survivor with ALK positive stage 4 lung cancer. Yes, thank you. Doing well. Recently had scans in April, I believe. Might have been March. And there was no evidence of disease. So I'm very, very thankful that these medications that, we've had clinical trials for, that the science of ASCO was presenting on, 10, more than that, 12 years ago, are working for us today. So that, in and of itself is amazing. But I've worked in scientific publishing for over 20 years, and I am currently at a med farm company where we are producing a podcast for cancer oncology doctors. I also have a platform that we are launching, or just recently launched, called In Practice for community oncologists. And that's what brought me to ASCO this year. I was actually invited to go as part of an advocacy thing, but my daughter previously was going to have a volleyball tournament, but we ended up not going. So I had time to actually even go for work as well. So I feel kind of blessed, that I'm able, for my job, to also tie into my advocacy work. And Sydney was so nice to agree to help be on my editorial board for this with my work, and also be interviewed. So we were interviewed by my boss at ASCO.
Nice. Okay. All right, I'm going to try something real quick, y'all. Bear with me for a second. Nice. God, I love this platform.
Sorry, you guys love it.
It's dangerous. Now I got sound effects. Oh, I got gongs and all kinds of stuff. Y'all better watch out. All right, here we go. No, but that's great. Brandi, welcome to the conversation. We're super glad you're here. As I was mentioning earlier in the show, I'm just excited to talk to you guys, because I feel like going to ASCO is like the next step for me. Like, I really would like to go to a conference like that and just be in that room. And so hearing the various ways that you guys were there and in what capacities you were actually presenting and chairing and championing and everything else is really exciting to hear. So I'm now my brain is thinking about ways that I could potentially find my way to ASCO next year. So Colette, can you jump in real quick and just talk about what you were doing there? Because I believe we still have to hear that from you.
Right. I attended as a patient advocate. ASCO offers scholarships and in various dollar amounts. And I applied, and I got in. I got a scholarship, and I was able to attend for the very first time. So that was wonderful.
Okay. Well, that's okay. So scholarship. Let me make a note of that.
Yes. I early get a letter of support from someone in your community who knows what you do and how you advocate, and just give them a really good story of why you believe you should attend and how you plan on taking what you learn and bring it back to the community. I think that makes a difference, how
Absolutely.
you plan to apply it. Yeah.
So now that you guys have all been there, you've had time to digest the information that you've learned and everything else, and really take in like the fact that you went to this massive conference and, we're really just part of some really progressive science and medicine. Was there anyone like in particular that you were excited to see, or a particular discussion that you were like, I don't care what else I do at this conference, I'm going to this, or I'm going to meet this person? Who was that, or what was that event for you at ASCO? And if you got it done, or if you met that person, what was it like when you actually did? And I'll open it up to anybody.
I can start with that. I didn't have any particular person that I wanted to meet, but at these conferences, I use it as an opportunity to network and to find out who some of the folks are who are working in the field, what they're doing, how I can partner with them, how I can bring this information back to my community. So, with that said, I met two amazing organizations, Health, Hope, and Hip Hop, and they are a community organization that bring awareness and action to the community through hip hop and the culture of hip hop. And it was amazing to see some Black men on that platform encouraging other Black men to do likewise. The other group or organization that I was excited to see was ALCSI, the American Lung Cancer Screening Initiative, an amazing group. This is a group of students, high school students, medical students, college students, physicians across the United States, 150 chapters, bringing awareness and screening guidelines to lung cancer, mainly through grassroots initiatives and policy. And they have monthly meetings, and I encourage you all to become involved, attend some of their meetings, even become speakers through some of their meetings that they have, because they want to hear from us, the patients.
Okay. That's excellent. All right. And so you were able to sort of connect with them. And is there anything coming up that you were like maybe working with them? Or have you figured out a way to connect and align yourselves with them?
Actually, yes. With the ALCSI, they are having a monthly meeting in August, and I'm going to be a speaker at that meeting. I'm also working on connecting with someone at the Bronx chapter because I'm working on another project for Lung Cancer Awareness Month. And I'm hoping to collaborate and get some funds in to take some of the strain off of myself and to just bring this information back to our Bronx community.
Let me get this straight. You're already working on Lung Cancer Awareness Month?
Yes, ma'am.
All right.
Yes, ma'am.
AKA, I'm behind already. Okay. All right.
No, you're not. And Heal Collaborative is also coming to the Bronx. So I've connected with them as well. So I'm excited about that. I won't talk too much about that because nothing's really happened yet. But I'm so excited for this fall season. Lots of good stuff to come.
I might be biased, but Heal's a really great organization to be a
It
part of.
really is. Heal brought us together.
They did.
It us. And I thank Heal for providing this platform as well.
Thanks for saying that. I'm just kidding.
They're amazing.
So Sydney, Brandi, either of you guys, was there anybody in particular you were excited to meet or any discussions that you didn't want to miss out on when you were at ASCO this year?
Well, I don't know if you know this, but Dr. Lam actually presented on his ALK vaccine while there. Yeah, I mean, of course, it's preliminary, but one of the things that it really did say is that he did see that there was a immunologic response to some of the resistance antigens that they were trying to build resistance or immunity to. So it looks like it's working in terms of building that response. So now to see if does that response really mean that, these patients will not get these resistance pathways. That's one of the things to next see. So I was actually very interested in hearing about that, of course, as our oncologist, and two, that would be something that in the future possibly could be something that we could get to kind of make sure that our immune system is able to recognize and kill off any sort of resistant strain of these cancer cells.
Like, imagine if we're just on like the latest and greatest targeted therapy, and then we get the vaccine and it just prevents those resistance pathways, you know what I mean, from popping up, and we just stay on this medicine, like, and we just live. Like,
exactly. We just live.
The end of story. We just live. Like, that would be amazing.
Speaking of which, there's another study that was presented. It's called Interception. And I'm going to try to explain it in layman terms. And Sydney, since you're the subject matter expert with the science and the terminology, I'm going to depend on you to keep me honest. So these two researchers believe that there's a specific formula to cancer. And here we're talking specifically about lung cancer. The final component of the equation is inflammation.
Mhm.
And these physicians believe if they can give you a certain blood workup, they can measure the amount of inflammation in your bloodstream and actually intercept lung cancer up to 5 years before it actually forms. That is hope.
Oh, yeah.
That is hope.
remember,
That is
I
hope.
remember, I remember reading about that actually.
Goosebumps.
Yeah, I think when I heard about it, the one thing that I questioned immediately is, okay, so how are you now going to turn around and deal with the inflammatory microenvironment? So, are you now going to put them on, anti-inflammatory medications to prevent the cancer? How do you deal with the follow-up for this? And, just because you have the inflammatory markers, what are the chances? How high are the chances that you're going to develop cancer? So now you're putting patients prophylactically on medications, but are the risks really that high? That was like all of those questions popped up in my head. And I
Right.
remember I need to read about this a little
Yeah.
bit more.
Yeah. That's one of the things that they mentioned in the study. There's a video out there on YouTube. It's called Interception. How can a little pill prevent me from getting cancer? Something to that effect. I'll share the link sometime later. But that's some of the things that they speculated about. Not medicating patients unnecessarily, and
Yeah.
how do they prevent that?
Yeah.
Yeah. So it's early, but it gives me hope.
They also had a study there talking about like they're seeing responses with GLP and decreasing progression rates. And I remember thinking, oh, I need to go look into that too.
Brandi, how about you? I want to jump to you and just see if there was any conversations you were excited for, or anybody in particular you were hoping and looking forward to meeting at ASCO.
I was so busy working. I did not I didn't even have time to go to any sessions, but I was excited that I got to, meet some of the people that we were interviewing. So lung doc, Dr. Eric Singi was there, and he is also on the board. And so we were able to interview him, and that was good. And I was honestly just happy to see my friends.
Yeah.
I was happy that I, knew people and that they had, something for patient advocates there. I would like to dive into to see what more of what they offer. Like Colette, you would know probably a little bit more because you even took the time to look and see like how can I get to ASCO, and found out that they have a scholarship available. So, I'd like to be able to critique what is it like there as a patient advocate in the future, but I'll probably be working for the next few ASCOs.
Yeah.
And
Well,
I mean, the thing about the presentations is like you definitely have to go prepared because the science is the science. So a lot of it will fly over your head if you don't like make preparations to know like the baseline definitions, that sort of thing. So I think it's good for awareness for patient advocates to go, because then it helps them to say, okay, I didn't understand this. Let me go and research this more, so you can then understand what are these researchers actually saying.
Yeah. And I think it's great that they, like, I was talking to even some other folks who have been there before. Like, you want to have a plan for ASCO. It's like you've got to have your agenda ready. You need to kind of identify what is interesting, what you want to see. And some of those sessions I heard were like, a couple of years ago, especially for some big announcements, are standing room only. And these are rooms that hold thousands of people,
Mhm.
like thousands of people. I did make it to a few sessions, nothing that I was like particularly excited about, but I was able to see some sessions, and even those were still rooms that would hold 1,000 people or more, and several screens are up. And Sydney is right. It'd be good if you aren't like into scientific the language, to get that basic level of understanding, so that when you go in there you can understand a little bit more of what they're saying, just so you can get what those values mean,
Yeah.
and get that hope even more, because you'll see why people are excited about the overall progression rate, or using all of these different acronyms. It would be good to just kind of go in with your little cheat sheet of, oh, this is what that means.
Now, do they I guess share ahead of time what sessions they're going to have at ASCO? So it's like, if you're going, like, so you guys are talking about doing your research before going. So it's like, okay, I know I'm going to go here. So maybe start looking up some of the things and some of the terms around that topic, so that you kind of have more of an understanding.
And it's a lot of walking.
Okay.
So wear comfortable shoes.
A lot of walking.
No Jordans. Yeah.
Don't even come in there with anything.
Oh, wait. Sydney, you wearing heels at ASCO?
I did.
Scared of you, girl. Scared of you. Where my sound effects at? Hold on. Let me find these sound effects. Yeah.
You know me and my heels. I love my heels.
I know you do. I don't know why you do, but I know you do.
She's daring. She's a daredevil.
You gotta love your feet more, girl. You gotta love them more. You gotta be nicer to your feet. So, ladies, was there anything that you wanted to see more of? I mean, obviously timing is probably a thing, like you don't have enough time to see everything, but was there anything that you're like, man, I want to see more, events or summits that do this kind of stuff? Like anything that you think we maybe should pay it forward with in other areas? Or any maybe conversations that you may want to see in other areas, more conversations around things?
In the smaller community sessions, like there was a particular conversation for the LGBT community. I learned a lot from them. Things that I'd never even thought about. It would have been nice to have more of those sessions. It wasn't very well attended, maybe 20 people. It was a smaller room, but it made me aware of some of the things that impact that community, and how I can take this information and apply it to my community as I continue to do my advocacy work. I would have liked to see that. I would have liked to have seen more, as far as from the pharmaceuticals, more representation of their patient advocacy programs. If you're attending and a part of this is to market to us, the end users, where's your patient advocacy group?
Yeah.
That was missing.
So I can tell you this much. The patient advocacy group is there, but the patient advocacy group has already sent out their emails to have interviews with different people. So they're in a tucked away room having interviews with people. So like I met with a few organizations while I was there, and that, for instance, some of the sessions that I would have wanted to go may have clashed with the interviews that I had. So it's kind of like, I think that is the mismatch, in that, yes, they probably should put someone there. But I think because I guess not a lot of patient advocates are there. They kind of are not as stationed as we would have liked, because Colette and I went to a certain organization specifically looking to talk to them about wanting to join their patient advisory board or something to that degree. And no one was there. Everybody tried to run around. They're like, oh, they're not here. They were just here. So, I mean, yeah, I definitely understood the frustration. But I think that's also a part of it, is that they schedule some of their meetings beforehand.
Yeah. Like you guys said, you got to prepare early for ASCO. You can't go in there half cocked. You got to be ready to go.
Yeah.
Yep. Anybody else, anything else that you would have wanted to see more of, or, just things that maybe other summits and events should think about doing at their, conferences?
The headshots were amazing. Now I don't have to pay for headshots.
That's my favorite. I
And
can tell
I got
all the
several,
headshots
and
I got are like,
they're very professional looking. And we had change of outfits every day. So
Oh, wow.
okay. Wait, how many days were you guys all there? How many did you all go the same length of time, or?
I think 4 days.
I was there for three days.
Sheesh. Brandi, what about you?
I think 3 days.
Okay.
I think we were there for 3 days as well.
Wow.
Yeah, I was there till.
It's a longer conference.
I was there for 4 days.
Yeah, I think it's like a 4 or 5 day conference. So I mean, it's not like the other ones that we've been to.
Mm-hmm.
I love that. All right. So as we start to wrap up the episode here, I want to see, like, obviously there's plans for you guys to go next year. Are you planning to do it the same way you did it this year? Or are you planning to like be speakers, or are you looking to be patient advocates? Brandi, I know you're going to be working, but like, in what capacity are you thinking about attending next year? Or what would you like to do if you were given an option for attending next year?
Oh, if I can attend next year, I would like to be able to make that plan. Like somebody said, it's like planning your Disney World trip. Like you got to know which rides you're going to get on and like how long you're going to be waiting in line. Like you just have to plan every single thing. Oh my gosh, nobody talked about the food, y'all. The food at ASCO is crazy.
Let's talk about it.
The exhibit hall was amazing.
Exhibit hall. That's what I mean. I mean, I was in the exhibit hall most of the time. The food at ASCO is wild. It was so great that I skipped my hotel's breakfast just to eat at all the different exhibits.
Okay, so let's break it down. Like, what kind of food are we talking about here?
I mean, like custom. There were lots of custom like coffees. Like they would grinding the beans right there. Order it however you like. Okay. That somebody had. What did we eat one time? We had
guacamole.
Yeah, guacamole. We had like this special season tater tots.
Yes, those tater tots were so good. They would have a different variety every day. They had street tacos.
It's little place, but they're good little novelty.
It's super tiny. You have to walk around and go back and get another one. Somebody had deep dish pizza. Like trying to they were.
I mean, you're in Chicago,
yeah, we were in Chicago.
I'd be offended if you didn't have deep dish pizza and you're in Chicago.
It was just okay. I was like, meh, this just makes me want it. But everything, that part was fun. I mean, there was lots of good things, but it's a lot of money spent. What I would like to see, honestly, I'd like to challenge. I think that they should do a challenge one year to take for these companies to take some of that money that they are investing in these $1 million displays, millions of dollars, some of these displays easily cost, and pour it into patients, pour it into helping patients, like get a patient fund and just say, this is our, we're going to have just a plain old regular booth at ASCO. We're not giving y'all custom lattes and special tater tots. Even though I enjoyed that, I would rather them take that 3 million, 10 million. Some of them I heard rumors of more money than that they cost, because some of these were so big. Like we should have brought pictures and sent you guys like some of the videos they had were such massive displays that you could really help a family pay for a year of rent. Like, I think
I was at ASCO. My likeness was at ASCO. I'm pretty sure Gilead had a whole like thing with me in it, and I was like, well, at least some of me's at ASCO. It's like, you need the real thing there. Like, I could stand next to the picture and be like, yeah, like, bring me on. Let's go.
I would have loved to find you.
Man, yeah. So I feel like, I don't know if it was this year or last year. I just know I was like, well, no, whichever one was in like Madrid or whatever last year. I was in Madrid, but I was not in Madrid. So I was like, I'm there.
Barcelona, World Lounge.
That was it. Yeah, that was it.
Mhm.
Yep.
Now that we're at the end of the meeting, I've finally figured out how to connect on my phone where my camera is 1,000 times better, but that's okay.
It's
I'll
all
keep
good.
it.
The message is what's important. But yeah, so everybody who's going back, are you like Sydney, do you think you're going to be invited back to do this again? Do you see this being like a regular thing, or was that like a once in a lifetime opportunity, do you think?
I don't know. We will see. We will see. They do actually have this thing called ASCO Voices, which is kind of almost like a TED Talk kind of forum for ASCO.
Okay.
So I was watching some of it, and there was actually a really good speaker there that I'm actually going to go look her up a little bit more. But I was like, okay, that's something that I would love to be able to do eventually, kind of, an ASCO Voices sort of presentation.
You know, it's my dream to have a TED Talk someday.
Mine too.
Good.
It's on my to-do list.
It's definitely on my bucket list, do a TED Talk. So yeah, we can make that happen.
You sure can.
Yep. All right. So the last thing I'm going to ask you guys is, before I, give you guys the opportunity to do your contact information, like I always do, just what was the main takeaway you got from ASCO this year? Your 1 minute takeaway, from what you saw or what you experienced. And then again, you can give your contact information when you're done. Who's going first?
Well, from my takeaway from ASCO was basically that there's so much that we are still learning about lung cancer and cancer in general. Actually, Jamie, I forgot to mention that they did present on the Crown study, and lorlatinib still has not met the median progression-free survival mark. So they're now 7 years in, and they still have not hit 50% yet. Yeah. So
that's why I don't want to be on lorlatinib. Not interested.
No, well, the thing about it is that 50%, basically what that's saying is that people are going on lorlatinib for a very long time without progression. They've hit 7 years and still people are on it without any progression. So
the mental thing.
That's a whole nother story.
I just heard too many horror stories about the mental effects of lorlatinib that I'm like, I hear it now and I'm like, oh, no. It's like, I can't, this is the moneymaker right here. Like, I can't lose my mind now. Like, come on. So,
I mean, yeah, that I'm not going to dispute that. Definitely not going to dispute that. But for people who don't have the option,
yeah,
I think that is also a good sign of, how far cancer treatments have come to the point where you can be progression free for 7 years. And that's great, versus crizotinib, the mark was, I think, 10.9 months. Yeah, exactly. So that just shows you how much better these new drugs have gotten.
That's true. And, the other thing to consider too is that like not everybody has the same side effects with medication. So like some folks don't have mental issues or mental side effects with lorlatinib. It's a gamble, of course, but like, some folks don't have the same symptoms and side effects that we have on alectinib. Like there's a lot of side effects that people experience on this medication that I personally have not had, knock on wood, yet. And there's a lot of stuff that I have that other people may not either. So you never know how you're going to respond to a drug, but I think I'm a victim of like the horror stories I've heard where I'm like, oh no, like you just have like a PTSD from not even being on it, from just the fear of hearing about it. But anyway, I digress. You're supposed to be giving your takeaway and your contact information. So I will give you back the stage, ma'am.
Oh, contact information is Dr. Yola Olo, OLO, only lives once. You can find me on TikTok, Instagram, and Facebook.
All right, there you have it. And who wants to go next with their 1 minute takeaway from ASCO and then your contact info?
Okay, I can go if that's all right. My biggest takeaway from ASCO was hope, and it's hope fueled by science, innovation, and collaboration. There's a lot of great medicine to come, and we're going to be a part of it. My contact information is Healing the Bronx, and you can find me. That's my Gmail address. And you can find me on Instagram.
All right. Sounds good. And Brandi, we'll jump to you next.
So for me, I guess I'll say my biggest takeaway with ASCO was really still more on this, targeted these biomarkers, all these targeted things that they're focusing on. I feel like they talked a lot more about CRAS lately, and I'm excited about that for those, people that we know and have lost with CRAS. There's a lot more hope out there for those who are diagnosed with CRAS, and even like these biomarkers like HER2, which when we were diagnosed weren't even a lung thing that people were finding. So I'm excited, for these folks who have that passion to help find cures and treatments that will work well and effectively. I'm excited about that for ASCO and for, just, yeah, it all goes into hope. Everything goes into hope. And so for me, my contact information for my public advocacy page is me, the letter U, we, and my email address is Brandi with an I, at imeuwe.com. But go to Instagram. I'm not a Facebook girly, so don't send me a message on Facebook. I won't see it for 4 months.
That's so funny. I just realized that's what your email meant. I was like, I don't know what her email is.
Yeah. It was supposed to be a site where I was just like blogging and talk about life and motherhood and, why is milk so expensive? But now surviving.
All right, folks. And I don't have a key takeaway from ASCO because I was not fortunate enough to attend this year, but we're going to run this conversation back next year. And hopefully I will have something to say because I will have went. But you can find me on social media. I am _jams on Instagram. I'm Jamie Jam on Facebook. And It's Just Jams on TikTok. I want to say real quick, thanks Body Politic on YouTube for the love. Everybody else, thank you for joining us and watching us on YouTube and on Facebook. If you missed any part of this conversation, it'll be simulcast on all of those pages. So make sure you lock into Heal Collaborative on Facebook and on Instagram and on YouTube. And you'll definitely be able to connect and catch past episodes as well as future episodes that we have of the show because we're getting ready to expand this. So keep it locked and definitely stay tuned. Ladies, I want to thank you for your time tonight. Thank you for your continued advocacy. Colette, I can't believe you're working on Lung Cancer Awareness Month already. I will jump into gear. But no, honestly, thank you, ladies, for all that you do in the lung cancer community. I think we all stand on each other's shoulders, and we are just a room of giants because of how much work we do. And I'm grateful, and I want to give y'all your flowers while we still are here to smell them. So keep doing the good work. Keep on doing everything that you're doing. Even if you feel like you're not making a difference, folks are watching, and we're making an impact. So yeah, I just love y'all. I appreciate y'all.
Love you too. Thank you.
All right, everybody be safe, and we'll be back again on another episode of Voices That Heal. Thank you for tuning in. And if I don't hear from you all or I don't get to talk to you guys, have a safe and happy Father's Day, everybody. All right.
Bye.